What is the role of BIRAC? How it has been supporting these research?
BIRAC started in year 2009 as an experiment, and it was hugely successful. So we gave a lot of loans and grants to innovators and startups, and many of them were successful. So later it was thought that why can't we create a separate body, council? So then BIRAC became BIRAC after the cabinet approval to directly fund the startup.
Dr. Kumar, there is a perception about India that we are very good at reverse engineering, especially in the medicine space or healthcare space. When it comes to real innovations, researches, how much you have seen India building or focusing on that space?
In innovation game, I'm saying, we are now in the process of creating that ecosystem which America created 100 years back. That's why BIRAC's role is very important, that it is funding deep tech innovations.
What kind of innovations you are now seeing in India, which will help us reach developed India by 2047?
The innovations that we have been focusing on, which are more deep tech. So one could be, I can say, mRNA vaccine, which was thermostable, has been funded through BIRAC, and the company's name was Genova. Then one more innovation I would like to say, there's a company called Revelations Biotech. They have developed something called CFOS. These are fibrous sugars. It is as sweet as sugar, but it will not increase your glycemic index. For diabetics, it is very, very safe.
In COVID time, we saw from our research capability also that debates happen in weeks or in months. On that scenario, what was the role BIRAC was?
At every front, right from sanitizers to masks to PP kits to ventilators, you name it, and BIRAC's role will be there. Even Covaxin, for example, Bharat Biotech, they did lot of testing from our supported startups in incubation center. For everything involved, BIRAC has played a humongous role. Now we have to take it to the next level.
You have lived the American dream. How the Indian dream would be for everyone?
Indian dreams would be
Welcome to another episode of How Boring, where we dive into topics which may not be making news every day, but are critical for our health, our happiness, and our life. When the last time you used a safe vaccine, or you used a rapid test kit, or you heard about a medicine coming from India? There is an organization which has been supporting many of these innovations, and you might have not heard about them or this organization. BIRAC, the Biotechnology Industry Research Assistant Council, which works under the Department of Biotechnology under the Government of India, is an institution which has been supporting many of these innovations in this country. Today, I'm thrilled to have somebody who has been steering this mission, Dr. Jitendra Kumar, who is a scientist, a visionary, and an administrator par excellence, who has been driving this organization to contribute to lot of meaningful innovations which are critical for the growth of this country and the well-being of our people. Today's conversation is going to uncover lot of fascinating stories of science and innovation, and I promise you it is going to be anything but boring. So welcome Dr. Jitendra Kumar on this episode of How Boring. BIRAC has been a name which many industry people must be quite aware about. But when it comes to life-saving technologies, innovations, a lot of that has been happening in India, and it is starting. So what is the role of BIRAC? Let's begin with a very basic understanding of BIRAC, how it has been supporting these research, and what these research mean to the welfare and well-being of the people of our country.
So let me start by giving you the brief background of the formation of BIRAC, how it formed. So actually there was a project, it started in a project mode, Biotechnology Industry Research Assistance, a program. So it started in a program mode under the Department of Biotechnology. So why it started? Because there was always a felt need that we are not able to promote innovations and startup culture in India. because especially in biotech, in other fields also, but mostly in biotech, the time for taking the innovation to market is very long, and it is very costly. So there is a entry barrier into biotechnology entrepreneurship, and it is very, very risky. So why government cannot support startups and innovation? However, the problem with our governance and world over, I'm just saying from governance point of view, government point of view is that how do we actually give money to the private entity, public money? We cannot give to private entity like that, because it's a public money. We are not, see, you cannot give to private entity because taxpayers money, there will be a lot of objections. However, we made a case to the government that this is required for the national interest and national growth, economic growth of the country, because entrepreneurs are nothing but economic engine for the nation. So it was through a cabinet approval that we actually included in the cabinet approval that the body should be created which can directly fund the startup companies. There is no such mechanism in India right now which can directly fund the startup. Maybe there are some initiatives, but those are not very, at least in biotech, they are not there. There may be some sector agnostic initiatives like Technology Development Board was there, which was funding, startups and industries. However, they were, of course, sector agnostic, and they were not actually promoting the real deep tech innovations in biotech.
Maybe they are not supporting research. They may be helping you in scaling up your business.
It is, but they did their job actually. When BIRAC was not there, definitely they were there to help. Then NSTDB was the National Science and Technology Entrepreneurship Development Board from DST, which funded a lot of incubation centers, no doubt about it, and they funded the startups through incubation centers, but not directly. Then, of course, later on, Startup India came and Stand Up India came. However, BIRAP, which is Biotechnology Industry Research Assistance Program, it started in year 2009 and as an experiment, and it was hugely successful. We started few programs under of course, the then leadership of Secretary and Minister, and it actually was successful. So we gave a lot of loans and grants to innovators and startups, and many of them were successful. So later it was thought that why can't we create a separate body, council? So then BIRAC became BIRAC after the cabinet approval, and it became a Section 8 company, you can say a public sector undertaking, central public sector undertaking, to directly fund the startups. So this is the genesis of BIRAC, and right from 2012, when it got incorporated as a Section 8 company, as a public sector undertaking, under the administrative control of Department of Biotechnology, it started various programs in our country. These programs were started after careful mapping of the innovation ecosystem in the country. I'm talking about biotechnology. In other areas, I will talk later, but let's talk about biotechnology. And biotechnology, I'm talking in a very broad sense. Biotechnology means using living resources, living organisms, or life sciences principles in solving problems, human needs, human challenges that the humanity is facing. It could be in life sciences, it could be in agriculture, it could be in industrial biotechnology side, it could be in environmental biotechnology side, it could be in food and nutrition. And you can think of any area which impinges directly on human health and life. Even if you talk about, IT, we have some innovations where, scientists or innovators have come up with some kind of a screen coating, maybe using microorganisms, where the life sciences principles were involved in the computer, so that, it does not impinge the health of the worker. And then, of course, the principles of life sciences of how do you actually interpret health. So what are the parameters that you're looking at? What are the changes that happen in the eyes, retina and all. So all those things become, I'm just giving example how far and broad it is.
Right.
And also maybe climate change, how we can reduce the carbon emission, how medical devices. So you may think that where is the genetic principle involved? Medical devices would be mostly electronics and IT. But the problem, you have to we have to see that how actually these medical devices are involved in patient safety and health, and how it can be devised so that patient health safety is
or how it is interfering with the
bioprocesses.
Yeah.
So therefore, we consider all this in the area of life sciences and biotechnology.
Wonderful. So it's been nearly 16 years of
around 13 years from
BIRAC. We look at the program phase and then the institutional phase. So nearly 13 years, which BIRAC has been.
You can say that in 3 years, it was in womb. Yeah. And then real birth started in 2012. So we can start with 2012. So it has reached now teenage, so maybe 13 years now.
Wonderful. Dr. Kumar, normally there is a perception about India that we are very good at, reverse engineering. We are good at, once things are out of patent, especially in the medicine space or healthcare space, then we are able to, kind of come up with a more generic version. We are very good in reverse engineering and scaling up production. We are the kind of a pharmacy for the world. I think every third child in the world get vaccine which is manufactured in India, which is more about how you scale up on a generic space. When it comes to real innovations, genuine researches, how much you have seen India kind of building or focusing on that space? Because starting from 2012, as you said that this has been a journey, and I'm sure multiple such research has been supported. How much overall interest of the industry also you see? Is our industry really very keen towards investing time, energy and money, supported maybe an institution like yours, to look for the the original researches or innovation, or they continue to more inclined towards get something which is quick fix, faster and scale up business, something like that?
Very good question. Let me give you some perspective to it, actually, because this is something that every Indian would like to know. First of all, as you rightly said, we were known mostly for generics and contract research and development services, contract services, meaning what? It's not only products. I mean, many countries used to outsource their services to us. Like, okay, you map the, sequence the gene and give us, or you purify the protein and give us, something like that. And we are still holding that ground. We have a lot of companies from abroad who are doing, we call it contract research and services, or contract research and development services. There is no harm in doing. If we have that strength to push the economy, it's good, and we have taken the lead in the world, as you know. So it's good for economy. It's good for a lot of employment is generated. However, it will not make a country prosperous. When I say prosperous, it means country which is having a good standard of living, and they have lot of per capita income and lot of developmental activities. For example, US, for example, Japan, for example, South Korea, and many European countries. So they are prosperous. Their per capita income is very high. Their standard of living is very high. Why it will not give us that edge if we keep on doing this contract research and generics market? Because by volume we may be leader. Okay, we are highest supplier of pharmacy in the world. We are vaccine leaders, but those are generic in nature. Therefore, we may not be able to fetch more money out of it. The value game, we are still lagging behind. So, and countries who have given lot of emphasis on innovation, for example, US, Japan, South Korea, European countries, they have at least from the last 100 years, they have been, pushing that. Except for Japan and South Korea, who has recently become, within 50 years, they became leader. But for example, US in 2000, in 1900s, early 1900s, it was underdeveloped and highly inefficient, corrupt kind of a government. And many people do not know, but this is true. 1900, initial part of 1900.
Right.
But they focused on innovation, and I can give you two, three examples which actually changed the way Americans were living. And for example, Ford car. Ford cars were actually, it was innovated by Henry Ford, who dreamt that middle class people should also have a vehicle, car. Earlier, it was not that engineering principles were not known. All the engineering of car was known, physics was known, but there was no innovation to make it affordable. It was not affordable. It was very bulky. It was inefficient also. Very bulky and aristocratic kind of people used to have cars. He dreamt and he created that innovation and came out with an affordable version of Ford car. And it changed the way Americans will live. You know, when the cars were affordable for Americans, actually they demanded roads to be built. And the roads, we see the best road, freeways in India, in US. And then people demanded, when the roads were built, people automatically, petrol bunks came up, and the, markets around in many places on the freeway came up, the big malls came up, because it created a market. Yes. When people are going through a vehicle with their family, they would like to take rest somewhere and go in the mall, etc.
So it created the whole ecosystem.
And then people demanded more and more better schools, because now they have the mechanism to transfer,
go from
one home to the school, which was not easy earlier. So new schools were built. So you say, and lot of them, proprietorship for these cars, spare parts, etc. came. Somebody was building tires, somebody was making the screw nuts and engine and all that. Fire, what's called, they have this.
So it triggered development in almost every aspect of life.
Area. And therefore, it also democratized the innovation, because people now felt that they can actually demand more from the government. Earlier, there was no clue how to change government, because now they have a clue that, okay, if we demand that these are the things we need, then they can create, a competition in the parties, political parties, and parties who delivered that, those things which people wanted, they will select that. So mechanism to actually create differentiation in the political parties and democratize, governance came. And the innovations in the government also, corruption-free, etc. It came actually over the period of time. So 100 years now, more than 100 now, we see America as a most developed country in every aspect: governance, corruption-free, efficiency, and economy, and etc. So think about Japan. They laid a lot of emphasis on innovation. Electronics. They took the lead. You remember Walkman. Sony Walkman. So it was a brand globally.
Right.
And then South Korea also had a lot of innovations. They took innovations from US and developed more affordable cars. Right. For example, Hyundai. Hyundai actually became more and more efficient and more affordable. So then it took the market. In US, again, if you see cars, then there was sewing machine. So earlier, it was a manual sewing for the clothes. But the sewing machine, Singer, he thought that no, it should be automized. And Singer machine was created. It created the whole
industry for maybe fashion, apparel.
People used to take proprietorship. He used to rent out his machine,
Okay.
And he used to. So it all developed
So one innovation can lead to
lot of things. And later, when we see biotechnology, we see that from 1970s, 1953, the DNA was discovered by Watson and Crick, and then 1970s we had the first recombinant DNA technology, meaning that you can clone gene and produce a protein in the microorganisms. Right. So that in 1973. And from there, we see the revolution in biotech innovations. So it all happened because US and other governments and the developed countries gave a lot of emphasis on innovation. And there was a whole ecosystem that was already created. That's what I'm coming from. So the game of innovation started 100 years back in many countries. Japan, of course, and Japan was destroyed in 2000, that war, Second
after
World War,
atomic.
Second World War. But now it's within 20 years it became superpower in electronics. South Korea, nobody knew in 1973, 70, South Korea. Now it is the most developed country.
So, Dr. Kumar, I'm getting tempted to ask one question. You talked about some of the countries which are the developed countries, developed economies, and we're discussing about how much we focus on the original innovation.
So
Yes.
let me answer that question. The previous question linked with this actually. So we are now in the process of creating that ecosystem which America and other countries created 100 years back. In innovation game, I'm saying. So that's why BIRAC's role is very important, that it is funding deep tech innovations. And then, I think many of these, so it's a mix right now. Right now, it's a mix of traditional innovation, generics, and where the opportunity lies, and in combination with the high-tech disruptive innovations, which can give to world, and it can lead India to a prosperity. It can become a prosperous country. We are on the way to that.
So
now
we are also, and the Prime Minister Narendra Modi has given this clarion call, and I think the whole ecosystem is, the whole the 1.35 or 4 billion people are very kind of optimistic about that mission of making India a developed nation by 2047. And you talked about some of those developed economy, and you also could trace their growth to these innovations. The focus to deep tech researches, to original innovation, which kind of built that kind of a ripple effect, which built those economies where they are today. We are on the same direction. So, what kind of innovations you are now seeing in India? Innovation and approach, both, the leadership approach, the focus, and the innovations which now as a country we are focusing on, which will help us reach to this or realize this dream of developed India by 2047.
See, ecosystem is being created, and it has been created to grow those innovations which can become a deep tech technologies. What are these areas? Actually, these areas are into different domains. You talk about healthcare, you talk about agriculture, you talk about environmental biotechnology, industrial biotechnology, food and nutrition. It encompasses all areas. As far as BIRAC is concerned, we have funded all those deep tech companies in these areas. Let's talk about few examples. For example, in healthcare, we are leaders in the pharma and vaccine world, as you know, and COVID time we have seen we are suppliers to the world about vaccines and all. But the innovations that we have been focusing on, which are more deep tech, we actually started funding, and we have funded, and they are yielding results. Okay, so one could be, I can say, first mRNA vaccine, which was thermostable, has been funded through BIRAC, and the company's name was Genova. So it has actually, it's world's first thermostable mRNA vaccine. Now, this is game changer for our country because, as it developed, by that time COVID had subsided. But let me give you an example where this technology, the platform technology, can be useful for helping fight any such pandemic which comes. Yeah, because the platform has been created. This platform is very unique. You see, our country has a problem of transportation. Cold chain is not so, in far off areas, you won't find that cold chain, and it's very costly. So developing a vaccine which is, thermostable, it can be stable at room temperature, is a landmark according to me. And the technology itself, mRNA technology, platform technology, I mean, I know that there was a technology already, in mRNA. It's not novel, but novelty lies in adapting it to the Indian needs.
I just heard about a book written by Renu Swarup and Dr. Narendra about fighting with a single strand, where this particular
mRNA
technology has been very clearly detailed how Indian science helped fighting the COVID-19.
Yes, and the innovation lies in how we have adapted this technology for Indian needs. and accessible and affordable is the key word for our country. So therefore, I think mRNA vaccine is one good example. Then we recently launched nephithromycin. Nephithromycin is an antibiotic which is coming out in the world after 34 years. Last time new antibiotic came was 34 years back. So first time it has come from India, any new drug, and that to antibiotic, which came 34 years back from the world. And BIRAC had supported Vocard. Vocard was the company. Now, you can say that nephithromycin, I mean, it's not so, but for our country, it's very important because it is, antimicrobial resistance, AMR, is a huge problem in our country. It has worldwide, but in India is the epicenter of that. And if nephithromycin is where they claim that it's like 10 times more effective than the current antibiotics, and it cannot develop. It's a line of defense where microorganisms cannot develop a defense, resistance against it. So it's, according to me, it's a landmark. And Vocard company, it's producing nephithromycin. Of course, it's not so much a problem in Western country. Of course, there are, but pneumonia is, of course, there also. I can't say, but tropical countries, Southeast Asia, other countries more. So definitely, it is our innovations can change the fate of many Southeast countries. So for Global South, India can emerge as a leader, at least for the time being, even if not a leader globally. For South, definitely it can. And through these innovations. Then, of course, HPV diagnostics, then for cervical cancer and HPV vaccine, we have, through Bill Gates Foundation funding and Department of Biotechnology joint funding, we have developed that. And chikungunya vaccine is under development. It has reached phase 3 actually. So Bharat Biotech is doing that. So there are a lot of such innovations. FibroHeal, another company which has actually developed a wound healing properties from cocoon, silk cocoon. And India is a leader in silk after China. And one other application that it has is through our company, which can. So wound healing means if there is suppose in war, there is soldier is bleeding, you apply this, it's a hemostat, it acts as a hemostat, and healing properties is much more. So definitely it is one of the innovations for our country, because here diabetic foot ulcer, infections are rampant, and this kind of innovation, low cost, you don't have to apply antibiotic and all this Western medicine. It's a protective here. So then one more innovation I would like to say, which is very, very interesting, and it has a potential to change the whole dynamics of the whole world, I am telling you. There's a company called Revelations Biotech, and it has been for last 10 years, we have been nurturing, funding, supporting, through BIRAC. And this company has come up with two concepts, and actually it is now commercialized also. They are selling already to many companies and confectionery companies and people who need sugars. So they have developed something called CFOS. FOS is fructooligosaccharides. These are fibrous sugars, meaning that there are sugar molecules which are actually fibrous in nature. So the glycemic index of blood will not increase if you eat it. Meaning that for diabetics, it is very, very safe.
You can eat sugar, but it will not increase your...
But these sugars are in a fibrous form.
Yeah.
They are into fibers.
Yeah,
so biochemically, they are
yes,
fibrous, oligofructosaccharides. So is it as sweet as sugar, but it will not increase your glycemic index, and it can go into various confectioneries, biscuits, and so many things without you worrying about your glycemic index. Right. So this is very important according to me, because India is a diabetic capital, and there are a lot of people who are suffering. They do not have alternatives. You can say there is a stevia molecule which can, which is, right, but those have bitter principle actually. They doesn't taste exactly as sugar. But here I am talking about exactly sugar, but in the fibrous forms. The key here is, you can say that fructosides is, FOS is well known. Of course, FOS is well known, but the innovation here is he has created a super bug which can produce this CFOS through synthetic mechanism, synthetic biology, using synthetic biology principles to produce in a very, very economic way, which can match the price of sugar almost. Then it has also come up with the protein sugar, which is called breazenin, which is identified much, I think maybe 50 years back in African berries. And he has cloned it in microorganism, and he is producing breazenin as a sugar. But it's a protein. It's not sugar. It's sweet protein, you can say.
Okay.
Imagine a diabetic taking protein and it's 100 times sweeter than sugar.
Yes.
And he's actually, so I think these innovations are going to sweep the world, I'm telling you. Because see, now people will say breazenin was known. I am saying the innovation lies in that synthetic biology approach where he has cloned the gene and patented it also and produced it in a manner commercially available. Because even if it's affordable, even if it's
accessible,
even if it's a high innovation, but it's not affordable, people are not going to use it.
Right.
It will lie on shelf. Even if they are diabetic, I'm telling you, people are so price sensitive. They will use sugar.
They are price sensitive, and there is also always a question of affordability. You cannot spend beyond a certain amount on a certain thing. Yeah. But I'm sure this is going to change the quality of life, I think,
think about those companies who are like companies who has produced this Ozempic and other drugs which Mounjaro, where people are taking for reducing weight, people are taking for reducing sugar, less sugar, but mostly for weight also. People who are not diabetic, they are also taking.
Right.
So it has all harmful effects. Doctors have documented that these are harmful.
Hey, these should not be taken without prescription or rampantly, I think.
But see, if they demand, doctors will recommend sometime, okay, you want to reduce the weight, you do. But I'm saying that they have a side effect. Right. But think about this kind of breazenin and CFOS coming to market, then people will not feel like they are taking excess sugar and they are putting up weight, because they will not increase the weight, etc. So bodybuilders, for example, they can use this protein as well as sweetener. They can.
Right.
Just saying, there are various examples where this can be used. We have heard that so many higher sugars were there in baby food, which was recently banned, etc.
Yeah.
So imagine this can be going into this. So BIRAC has funded that company, and the scientist, Dr. Ravi Biramchandra, he is actually a PhD from ICGB, International Center for Genetic Engineering and Biotechnology. And so all I'm trying to say is that these are deep tech innovations which are going to change the face of our country and make our country very, very prosperous. Our Honorable Prime Minister's vision of 2047 Viksit Bharat is very much, we are on the way, I can tell you. And BIRAC will play a very, very strong role there.
Since you talked about some of those innovations, which I think most of us have heard or seen, or in certain ways, like for example, you talked about mRNA vaccine. So in this particular thing, when we were in the middle of the pandemic, we were most of the people, our audience also, and I think even common men could understand that there is some kind of negotiation going on between the innovators, Pfizer and Moderna, and the government of India, which is trying to get the vaccine for the people of India. But at the same time, along with the multiple other, those negotiation or those arm twisting which were involved in that, in terms of giving sovereign
licenses and all,
guarantee and this and that, and not accepting any eventual side effect or something of coming out of it. But at the same time, one of the biggest problem was the storage challenge of it, because I think that vaccine has to be for longer time. It has to be stored maybe nearly minus 15 to 20 to 40 degrees Celsius or something like this, which is very, very I think
difficult for our country.
Difficult or impractical for a country of our size, and given the diversity and all that. In such kind of a scenario, so I would like you to kind of go a little bit more about it, that what kind of those challenges were, people can understand that how a vaccine which had to be stored on this kind of a temperature, BIRAC supported this research or BIRAC supported this kind of innovation, help reducing the temperature, and how it is going to further game change in terms of any future pandemic and other aspect.
Let me describe this situation which is there in the whole globe about the innovations, new, at least in the medical side, at least in the medical. I'll talk about other sides also, but medical aspects. Most of these are the innovations are done by the multinational companies. Vaccines, as I said, Moderna and Pfizer and all that. So, of course, one thing is that these multinational companies will try to maximize the profit. And also, the innovations that are happening in globe, mostly in US and Europe and developed countries, are developed overlooking the cost aspect. I think because they already have that infrastructure. For example, they may have cold storage, they may have electricity, they may have a lot of infrastructure given
hygiene,
which they might not even think while doing the innovation. But in our country, when an innovator does innovation is undertaken, they also think about these aspects: resource constrained environment. So the innovations that are happening in resource constrained environment like India, where you don't have a continuous power supply, you don't have an infrastructure for cold storage, you have a lot of issues. So there the innovations take into account these factors, and that's when they develop it. So of course this innovation, mRNA thermostable vaccine, was GEMCO-Vac, we say, it was developed by Genova, looking at these aspects. Therefore it was a unique advantage that India can derive to develop this, and the very fact that it is developed in resource constrained environment, which could not have been developed anywhere in the world because they don't face that environment. Now the cost is reduced, and then it's not that US healthcare is very, very cheap. They have insurance run, and cost of healthcare is very high, even in Europe. So these innovations can actually go to the US and other countries, and they may be preferred over their innovations. If it is thermostable, they may say, okay, even if we have electricity, why do we need to spend it?
Because it will reduce the emission.
Reduce the cost.
Yeah.
So India may lead in those aspects, even though we may think that it's not a great innovation, but actually according to cost advantage, this could be. See, innovations happen in three ways actually. One is cost advantage. Second is quality advantage, and third is combination of both cost and quality. So our country, the way it is moving, I mean, our innovators are moving, is incorporating cost advantage must, and then quality also, which may be lacking in other parts of the world. This is about vaccine, but let's say somebody is coming up with and there are companies who are doing this. They are coming up with the battery operated medical devices which can be run without electricity in rural areas. Now it may not be a need in the other countries, but we have developed, but the cost is less here. So one day we think that these innovations, resource constrained environment developed innovation, not only will change the face of our country, but it will be actually leading product in the globe also. It will be exported. So these are some of the things that India is doing.
So these innovation very well has the application in the developed world also, because in some way they will be, if not, kind of, at least it can help in conserving resources,
reducing the cost.
Since we are talking about the COVID time and related to COVID innovations also, so we saw in India, normally in the lifespan of a country or a society, any kind of this level of transformation takes maybe decades or some time, quarter of century or something. In COVID time, we saw from our research capability also that decades happen in weeks or in months. We could fast track our own indigenous vaccine, right from the research level to application. There is a movie made on that, The Vaccine War. We see, how our scientists were, kind of leaving no stone unturned, working day and night, and were trying to, with one single minded determination of creating our own Indian vaccines. On that scenario, what was the role BIRAC was playing? Because that is where, I think BIRAC's role, if it was, we haven't, kind of seen much, or maybe people might have not got to know much about it.
Yeah. So as I said, BIRAC program started in 2009, and as I said, maybe in the womb, but actually it was doing a lot of work. So it was like Abhimanyu, who was in the womb, who was learning a lot of things.
Chakravyuh.
Lot of things.
Yeah.
Chakravyuh was one of them, but he was learning everything from. So here, BIRAC was learning everything from the ecosystem. Their leaders, like Dr. Bhan was there, Dr. Renu Sarup, etc., and all that. So and later leadership also, like Dr. Gokhale's leadership is very, very, unique and visionary right now, who is taking it at the next level. So here what happened was 2009, 2012, and now COVID stuck in 2020, 1920. So we already had some mechanisms in place, fortunately, where many of these vaccines, PP kits, even sanitizers, even small things which we were having dependence upon China. If you remember, we did not have enough sanitizers, we did not have enough PPE kits, we did not have enough diagnostic kits. We were importing. But in the meantime, we had developed around 60, 70 incubation centers now, which is 100 incubation centers, where innovators were there in already working on certain aspects, developing their capabilities. And of course, research institutions were already ingrained, already there. But innovation centers, startups, culture was already built up. In 2020, for example, we had 6,500 startups already. So they were working. So as soon as COVID struck, they all came into action because the capabilities they had built already, they moved these capabilities into solving COVID now. They left all those what we were doing. They were doing. They immediately wanted to solve this problem because humanity was at stake. Our country, there was a doomsday for our India, for our country. I mean, people were saying India is gone. In America and this thing, forget India, it's gone, because we did not have enough beds, hospitals, we did not have ventilators, we did not have PPE, as small things I'm saying, sanitizers or whatever, PPE kits, masks were not, you can say. But all machinery of BIRAC, as well as other ministries also, I'm not saying other ministries also, but let's focus on BIRAC, geared into action. All these startups and industry, they immediately, I was a director of Bangalore Bioinnovation Center that time. And I remember that, of course, BIRAC has funded that, that center. I remember that we did not take even a single day off during COVID. We took special permission. All of our innovators were asking me to get to the government of Karnataka and government of India to give special permission to come to, because that time it was banned, no travel was not, you cannot come out of the home. But we took special permission for innovators that we are actually working to solve the problem in Innovation Center, and we worked day and night. And this is not only about Bangalore Bioinnovation Center. I'm talking about all the BIRAC supported, infrastructure or the capabilities. They sprung into action, and I don't think they even took any days leave. And BIRAC was full time working that time, And at every front, right from sanitizers to masks to PPE kits to ventilators, you name it, and BIRAC's role will be there. Even Covaxin, for example, which was one of the main vaccines during time, and Bharat Biotech, they did lot of testings from our supported startups in incubation centers, because it could have been done very fast.
Yes.
See, startups are very mobile. You do give something and they will immediately do it.
Right.
And they have capability. Agility. So they use those, although people may not know that many of the immunogenicity and studies were done by our startups in that Bharat Biotech, this thing, and it came to. So it's for everything involved. BIRAC has played a humongous role, and now we have to take it to the next level.
So from sanitizer to masks to maybe
ventilators
to vaccine, almost also, everything which people were getting benefited with, or found this as a very critical support to fight this pandemic.
Even
BIRAC had its role in that.
Even therapeutics also. pegylated interferon was developed through our BIRAC funding, National Biopharma Mission Therapeutics, which did not come into picture that time. Everybody was talking about vaccine, but at least therapeutics, one therapeutic came from India, which is, pegylated interferons.
Since you are a scientist also, and you said that, and you mentioned about how your institution and your team was working, without any break at that time, every day, special permission and all. It's just coming to my mind, from a lighter side also, in this vaccine war, there is a kind of a scene where a scientist who is working in ICMR, he's going to office, and it is the initial days of lockdown, and he's stopped by a policeman, and he says that, I'm a scientist, I'm developing vaccine, and then he gets a very rude response from that policeman. So how do you see that? Is it changing for our scientists post-COVID, kind of not only a fight but also a victory for that matter? Is our scientists are being seen more respectfully in our society now, given that we are focusing up to certain extent on innovation? We are now building a environment of innovation. Prime Minister has been time and again talking about and kind of saluting the role of scientists in advancement of society. We landed in the most difficult and uncharted part of moon. So there has been a lot of which is
south mode of the moon.
Yeah, so which has been a which has been showing steadily the scientific prowess of India. How do you see that perception towards science? Maybe more children will be taking science as a career. They would like to become scientists instead of the engineer, doctor, or maybe civil servants, or for that matter entrepreneurs these days. How do you see that?
See, I see our country as leader in science always, actually, with the intervening period of some time maybe. But say you talk about Vedic times, you talk about when people did not have even civilizational growth in other parts of the world. We had written Sushruta Samhita. We had already had lot of knowledge about astronomy. So we are talking about now looking at space through telescope, and discovering that there is a lunar eclipse, solar eclipse. But we find this mention about all these planetary things in planetary movements and other things in our Vedic literature. So they already had a lot of knowledge, and they were forerunner scientists. And in fact, the GDP of our country was highest in the world during that time. So there are already seeds of leadership in science in our society, in our country. And genetic pool, as you say, we are basically very, very well developed mentally, or we can say in terms of the scientific endeavors. However, maybe in the intervening period where our country receded into maybe aggressions from outer world, and then colonialism from the West, etc., it took a backseat, because it can only happen, all these innovations and growth can only happen when there is a supportive government structure, supportive innovation. As I said, America and all the examples I gave, innovations have to be supported, scientists have to be respected, funding has to happen. Because now we are talking about modern science. It's earlier, whatever science was done was through Rishi Munis, who were known for their intellectual capability, and they wrote some, mathematical treatises, astronomical treatises. Of course, there were institutional mechanisms. There was also patronage by the rulers, but it was not compared to modern science. Modern science requires a lot of infrastructure and government support and funding, and etc. and all that. So that was lacking in the intervening period. Of course, what can a country which is already colonialized by other country can do? So they will use only for their purpose. So whatever development they did was for their own development. But they never thought about country's progress, to be honest. However, after independence, Of course, there are a lot of institution building, as you see, as you can see, IITs and ISCs, etc. But still, the game of innovation was not there. As you said, rightly said in the initial part of your conversation, it was mostly we were known for generics and contract research services, and we were doing whatever reverse engineering and all that. There was a huge brain drain. Everybody wanted to have American dream. Every kid in science, they wanted to go to abroad, because without that they cannot do anything. And most of them, they settled abroad. They never came back. However, right from 2014, we see distinctive change in the strategy of our country. 2014 to, you say, 2024, if you see the statistics, it's amazing. The number of startups, which were like few hundreds in 2014, maybe not even 500, it was like 200, 300 startups in biotech. Now you know what the number stands, 10,000 startups. And these startups
10,000 only in the space of biotech.
The total number of startups is, has gone to 179,000 as per DPIIT. More than that, but I'm telling you some near, approximate.
Yep.
But I'm talking about biotech, because biotech is different, unique. Because as I said earlier, it requires a lot of time is very, long time for fruition, lot of risk, lot of infrastructure, entry barrier is very high. So therefore, this is very unique compared to a IT startup, compared to a electronic startup. You can start in your own home.
Yeah.
But here it's not like that. Yeah. Here you need lot of infrastructure, equipment. So entry barrier is so high. Cost of research is so high. You cannot, a common man cannot do unless there is a government support, unless there is an institutional mechanism to do that. So all that have been now, in our country has, so 10,000 startups, 100 BioNest incubation centers where they all can go and do proof of concept, whatever their idea is, they can actually, do proof of concept and take their innovations ahead. So I think now scientists and innovators and startups are given a lot of respect. Earlier, when you start your business, people are your own home, parents will discourage you. Your friends will discourage you. Everybody will listen. But now, no more actually. Startups are seen as an in thing now. You are a startup means people will give respect. Okay.
So a lot of, you mentioned about IT-based startups, a lot of software-based startup, fintech-based startup, they have all become unicorn. Are there some startups in the space of biotechnology also which have reached to that level?
So they might not have reached, but they are soonicorns, we say. Soon they are going to reach that. Okay. So for example, Revelations Biotech, I think it will reach soon. Okay. And even our own Biocon, for example, has already reached. It's a unicorn, to be honest. But we don't, it's not projected to be a startup anymore because it's a big company. But one day it was a startup.
Right.
Kiran Mazumdar-Shaw's company. Yeah. It was a startup in 1980s, it started and then it grew. So,
but normally startups are, in our
10 years.
Today's parlance, we see that, last 10, 12 years, something which has, like Zomato, like, Paytm, PhonePe.
So I would like to tell you that most of the unicorns, with all due respect to them, they are mostly aggregators, who have found a business model. And they have done innovations in the IT and processes, etc. And they have, like Zomato, as you said. But in biotech, the game is different. Here you have to do real innovation in the product or services, and then fit into the business model and, see that it is accepted by the clients. And you have to then think about competition with multinational companies who are already there to grab you. Think about competitions from other countries who are, definitely they will not like India to flourish. To be honest, there's a competition.
Right.
So therefore, our startups has done a wonderful way. Wonderful, they will always have been leaders who have actually taken a lot of risk and come out with a lot of innovations who are taking the country ahead. And they are respected a lot. Now it's changing. People are now, it's reverse brain drain actually. People are coming to India because India provides them the opportunity. You know that there are a lot of funding mechanisms from BIRAC, which has attracted a lot of talent from abroad. They say that, okay, now we can get funding as an individual also. And there are incubation centers. They can do proof of concept. Okay, let me take this grant from BIRAC and start my career in India. There are companies who are developed. I mean, they are outside companies and they are NRIs and they are OCIs, but they want to come back, even though they are not citizen of country, but they have linkages. They want to say that, okay, let's start something in India. They may be abroad, I mean, because they are OCIs basically, overseas citizens of India. They're first generation, repatriates. So they want to set up something and make a difference in their community. I mean, their own country of origin. So its situation has changed a lot, I would say.
So, Dr. Kumar, you were talking about reverse brain drain. There are a lot of companies, a lot of OCIs who are trying to set up businesses here and so on. I have also been hearing recently that a lot of scientists, researchers, professors, engineers, they are applying to various institutions in India, IITs, Institute of Science and those kind of places. And they are also looking, especially after this, the tariff war going on, immigration or migration overall, globally is becoming a big issue. I think every country is now getting up in arms against, or especially societies. They do not want, outsiders to be in their country. And especially at the same time, we have seen India becoming very strong, very confident and very progressive substitute. So all that which, attracted outside India is now India is kind of gaining back all those attraction. How do you see that reverse brain gain? And also, so instead of brain drain, I'm saying brain gain. And also how, what are the policies and how the Prime Minister's vision is helping to that? How do you see that, kind of developing into a scenario where we become the most attractive country for not only for our own people, but also for citizens from across the world?
Excellent question. So it's all started, when we became independent, 1947. We started building our scientific institutions. The science regained its prominence because colonial period. There were examples, luminaries in science, Jagdish Chandra Bose, etc. But after independence, there are a lot of institutes like IITs, ISCs, universities, which were, coming up in different parts of the country, and new generation was actually being equipped in new science, modern science, and lot of them. So there is American dream that we always say, American dream. This was actually engrossed in every middle class family's children, that we have to go to America. If not doctor here or engineer here, of course engineers can also go, but doctor, medical, engineering, and if they are taking science, mostly science and engineering students, their dreams will become that I have to reach American shores, or and then come. They always thought that they'll come back, but some of them, they never came back. They became expatriates. They became citizens of other countries. So we saw this, just after independence, and we saw this moving to peak in science 70s, 80s, 90s, and even up to 2010, 12, we see that this was happening. However, we saw some receding trend later on. And this all maps well with what we have discussed so far, at how Indian innovation was picking up and how there were a lot of standard of living of Indians were increasing. The infrastructure in every, so why people will go abroad, basically. They go abroad to experience higher living living standards, to be honest. And America offered that higher living standard. Living standard means you can send your children to a very good schools. According to them, they were like very good schools. Excellence in education. You can lead a very good life, hygienic standard of life. You can own car, building, homes, and lot of amenities which may not be there in our country that time. And you will have a high-paying job which will actually, fulfill your American dreams. And you become, that you have reached, you can say, salvation, that this is my salvation. This is what people used to think, that this is my salvation. I have reached this moksha. However, it was not as, rosy as it might think. In America also, there is a lot of struggle. It's not that from here people will think that it's a very rosy picture, but actually, if you go, because I was there for 10 years, it's a struggle. It's you have to establish yourself to get a green card. It's not easy to get a permanent position. It's not easy. Of course, you get a lot of advantages, which I said, that is institutional advantage. You have a lot of good roads, hygiene, good, lot of good, safety, security, and law and order, etc. You can say. And you can send your children to good
schools. That is also becoming questionable now. But that was at least a perception, and people enjoyed those at least some time. As you said, now it's changing. However, during this intervening period, India also took a lot of strides. Like, for example, we have metros now, we have good malls, we have good schools now, we have hospitals. So what is that it will attract them to go to, settle in US? There is nothing now which is so compelling for them that, okay, no, I will go abroad. Although there is still some magnet, but it has weakened substantially. With India's emergence as a fifth largest economy, lot of action happening, a lot of people see India as an emerging economy, as well as in every aspects of opportunity that lies. So there is now people are trying to come back actually, and especially now you said about tariff wars, so now what is happening? Every country is trying to protect going back to their roots and culture and protecting their domain. This is everywhere we are seeing. Every country, every culture is trying to go back to their roots because they are not finding the moksha and salvation in that kind of modernism, to be honest. They are saying that, no, I want traditionalism as well as development. I don't want to go to other country where I am targeted. What was your temptation to come back?
So actually, that time, 2009, definitely there was a economic slowdown. And definitely, even India was emerging as 2009-10. I said that India was actually picking up. There are a lot of incubation center. BIRAC was formed. So I was looking for a position across I'm not saying that India. Of course, my parents were here, and I had a lot of attraction towards India, affection towards. My father was in army. All those were there, but as you said, American dream and the compulsion to actually excel in life, etc., was also there. So it was a mix, but there was a slowdown, a global slowdown, and India was emerging it was not affected. If you remember the economic slowdown, India was least affected, and there were opportunities coming up. So I was offered, or I applied various places, and I was offered vice president of ICICI Knowledge Park. It was doing innovations in life sciences and all, and they wanted somebody who can steer it. So this is the kind of opportunity which I was waiting for so long, because India did not have the opportunity. For example, it was in Hyderabad, for example, but it may not, same may not be true with other parts of India. For example, you may not find that opportunity in Northeast, or say, in UP or Bihar or West Bengal. So the two epicenters of innovation which is emerging in modern India was Hyderabad and Bangalore, and Pune to some extent, and of course Delhi. So I got an offer, and it was compelling for me because I found meaning in coming back to India with ideal job and ideal, of course, salaries have risen in India very substantially, and opportunity to make a difference is something that is very, very important. See, in US, you can lead your life in a American dream way, whatever possible, but you will feel empty inside because you are not able to relate yourself to creating an impact, larger impact. You will be a system of a microcosm, and you can actually work day night there, and then personal gratification, satisfaction may be okay, but larger social impact, which are aspiring human being will always try to go forward in those directions. There you won't find that, to be honest. US, you cannot, you are, the system is such that you cannot. But India is an emerging economy and nation. You have a lot of such opportunities. And ICICI Knowledge Park offered me that opportunity as vice president. My job was to spur innovation in the region, not only in that park, but also in Hyderabad and adjoining regions. So it was an emerging bio cluster. So Shanta Biotech was there, CCMB, Center for Cellular Molecular Biology, Biotech Park had come, Center for DNA Fingerprinting and Diagnostics, Indian Institute of Chemical Technology. So it was emerging hub, University of Hyderabad. So you name it, there were institutions galore, and they were all trying to find ways in which inventions from the lab or new could go to the market. Translational research, and that's what I was, given the opportunity to lead. So it was an exciting opportunity, and I came back for a simple. And of course, there was a lot of, because I was eldest in my home. In Indian culture, you have to live with your, you find solace in, living with your parents and be their, support after when they become old. So all those things definitely are ingrained in us. But right time, right opportunity in career also made this transition very.
So, Dr. Kumar, India is becoming a magnet from multiple point of view. We have, as you said, great financial opportunities. Even the law and order is far, far better, and I think society, as a society also, we are much more, in terms of progressive, educated, and all those opportunities are there. There are still some of the areas which we lack, and I think as a nation we need to recognize and work on that also. Like, for example, air pollution is an area where many people, and we saw many people, not only let's say out of India, but many people within the country also. We see a lot of migration, people leaving Delhi and maybe settling to Bangalore. Now you settle in Bangalore, and the epic traffic problems of Bangalore, then which may push out to you from Bangalore, and you may like to shift to Goa or even something like this. There are certain those systemic issues which need to be handled in a much more deeper manner. How do you see them, and where the science is working and the government's vision and policy working in fixing these areas? Like, for example, you talked about quality of life. Quality of life also is very important. About quality of education we are getting, how much we are ensuring that our educational institutions are delivering that quality. The quality of healthcare, we have seen a lot of investment going into government's efforts, going into technology. We are providing the world class healthcare, and not only for Indians, but a lot of health medical tourism happening here. Then we see a lot of quality intervention now happening in the area of food also. But still there is always some kind of doubt in people's mind. Are we getting good air to breathe? Are we getting good food to eat? Is our water, good to be, kind of consumed from the tap? A lot of effort is going on. But how do you see that, and how do you see that these fundamentals can also need to be looked into on a very, very high priority? How do you see government focusing on it?
This question is very, very pertinent, I'm telling you. Although I said that the standard of living is now comparable to US, but those things are definitely there, which you just now pointed out. Good quality air, and which is now linked to the right to life. The Supreme Court says that if you are not being provided a healthy food and healthy water and healthy this thing, your fundamental right is in question. Many people have gone to court. So it's a fundamental right to life that we talk about in Constitution, that the state has to provide. And you're 100% right. As we develop, industrially, the pollution level and the environmental degradation is, it becomes much more stronger. And we have seen in all economies that have developed that. However, in India, I think much more needs to be done in terms of removing corruption from public places. Because see, if you go to pollution control board, sometimes people have told that it's not so easy to get the pollution control board clearance. So I'm not trying to say that government officials are corrupt or they are taking bribe and then doing. It's not like that. I'm not saying that. All I'm trying to say is that the mechanisms of transparency and clearance could be much more better. And I think Modi government has done, like from 2014, if we see the huge development transparency, if you see the online digitalization, now we are global, digital infrastructure is globally excellent. Recently, I went to Sweden. I could not transact because I did not have cash. They would not accept cash. They would not accept
outside
debit card, this and that. Clueless. Imagine our country where I can pay a vegetable vendor also through this, online payment. I asked him, is there no online UPI or something? He was blank. I mean, driver. He did not know what is this online, this UPI thing. So so all I'm trying to say is that transparency has increased, at least after Modi government came. So all the efforts are being done to address those questions which you said. For example, if we talk about air pollution. Now, air pollution has many different reasons and ramifications. One is the particulate count. Particulate count is definitely much more damaging to our chest, etc. And it is related to the construction work that is happening, cement, etc. and all that. Our roads, our land is not covered. I have gone to many places abroad, US or Europe, etc. There you cannot see any land which is uncovered.
Yeah.
They will cover it with either wooden straw or some, you can say that they are covered with grass and everything. There's no uncovered this thing. And then they also do a lot of sprinkling of water on the roads. For example, I was in Sweden. They were doing all the sprinkling of water. In US also this happened. And something has to do with the climate also. So we are in the tropical climate where a lot of wind and a lot of naturally these soil, etc. and all that.
Dust storm,
but this dust storm, and this coupled with the construction work, modern this thing has created havoc. For example, naturally you inhale soil is not bad. It's not. We have been from time immemorial. We have been doing that, but if you combine
to a certain extent, I think it is useful also in building immunity and all that.
Of course, it's useful because we have developed but if you combine this with carbon emission, if you combine with chemicals, if you combine with cement, then it's damaging.
There was a research recently that air in Delhi has a much higher level of mercury.
Yeah. So all I'm trying to say is that there has to be a lot of regulation and implementation and implementation of rules and regulations of environmental laws in our country. We see a lot of non-compliance from industrial units. That has to go. We have to be strict. If they have to treat the effluent, they have to treat it. They cannot be allowed like that. So that is what we are facing now. Here compliance is less. We have all the best rules. I'm saying law is best. Environmental laws are best in our country. If you see how environmental laws have emerged, you will see that you will pat the back of our judiciary.
Right.
That okay, my God, because it was not the legislature which took the action. Actually, all these laws were made by the judiciary through different case laws, where because judgments, laws can be formed through judiciary also. If they give some judgment, it becomes law. Actually, Supreme Court gives some judgment, it becomes law. So battery of such complaints petitions were filed by some NGOs or some good individuals, and then Supreme Court gave that okay, these should be implemented. They became laws. And of course, environmental protection law, of course, judiciary also.
Is BIRAC also supporting some of the innovations which are going to address these kind of problem of air, food, water?
Yes. For example, one company has come up with company's name is NanoSafe. So it has come up with a solution which you can put in, coat your water tanks. And even bottles from where you take water, and it will disinfect the water. So if that nano safe, for example, could be in many other government tanks, etc., and it's implemented, I think it will reduce water pollution
In water reservoirs
water
and all that,
reservoirs.
so that you have a more clean
Yeah,
water
more clean water.
being
So that can happen. So these innovations have to find ways of scaling up. BIRAC has done many such, they have funded or created programs. For example, we have created programs for safe and bio toilets, for example. We have run programs for ameliorating environmental degradation, air pollution, water pollution, nutrition, child and maternal health. All these we have niche programs here, like special calls for this, because we have created such programs looking at the same problem that you're talking about. So at multiple levels, if we fight, I think we'll be going back to our safe and very good environment. First, covering all the ground, with the grasses and wooden, etc. Then implementing the non compliance from the industries, that they should first treat the effluent and then they should release into the safe places, and all their level should be very monitored properly. Then doing innovation that I just said, nano safe, and even innovations like we have funded just now one company where it can actually capture carbon from environment. So microalgae, actually they can capture carbon from the environment. So then it can decarbonize our environment at the scale up level if it can be done. So air, water, everything, all these innovations that we are promoting in BIRAC will change the face of our country, I'm telling you.
Wonderful. One thing, when we are doing a lot of innovation, and India's gain can become in certain cases others' loss also, whether it is in terms of retaining our own brightest minds who will contribute to our own economy, or drawing back many of those who have shifted outside and actually helping other economies to grow. So when it comes to a culture of innovation, it will become not absolutely win-win for many. It will be win for us, so it can be lose for others. When we build this kind of a culture, do we also see some kind of a threats coming from outside, or maybe I'm getting tempted towards more of a conspiracy theory that people do, because as a country, when we will become a hub for innovation and a hub for talent and all that, we will not be dependent on many other countries which we are today. So do you see something of that sort also happening, sitting at the helm of this affair, some kind of challenge coming in, some kind of a discouragement coming in, some kind of a conspiracy being played that, okay, let's stop this innovation, let it not go to the market, something like this?
Conspiracy which I can tell is that many startup companies that we are funding is, and of course it's, I can't say it's a subtle or conspiracy as such, but of course they are protecting their interest and profitability, the other countries. Suppose we are funding these startups at the most crucial stage, most risky stage, when nobody was there to fund. Now suppose they have done proof of concept and they have come up with the solutions and they have come up with the innovations. They are actually, because they now want to scale up, so they want to get
they're
money
buying
from
them out.
They are buying them out,
And maybe killing also.
Killing also if they want.
Okay.
Because they will say that, okay, for example, Revelations Biotech, as I said, many offers, they daily come, okay, you come with us, we'll fund you this, that, and but he's not doing, because he knows they will kill that innovation, because they have to protect Ozempic
their
and
existing
Mauziana
business interest.
Yes. So that's why I'm saying this is nothing but conspiracy, according to me, in a broader sense of the word. Because they are, see, sometimes not good things may not come out because there are vested interests. Actually, there are all vested interests. Good things may not come out. For example, ACs are there, but we all know that it releases hydrocarbons.
What is the role of biotechnology in our day-to-day life?
Biotechnology is actually at every level of our lives, be it the food we eat, because this is some crops are biotechnology intervened through biotechnology, or breeding for high quality and high yield. Then you talk about water. Just now I gave example of NanoSafe, which can clean your water. Mitti Cool is another innovation where you can one of our companies have developed clay bottles which are corkable, or they have the cover, and it can be like 1 liter or even lower. So it's like a clay pot that we traditionally had. And the clothes we wear, for example, one of our companies have come up with the banana fibers, clothes made of banana fibers. So these are some of the innovations at daily life that we deal with, and medicines that we take. We do diagnostics for our blood, or go to hospitals for doing any diagnostic tests. They're all biotechnology, innovations are at display. Um, then infections that we get and detection that happens through biotechnological means. We also the air pollution that you talked about. We go outside and there's a pollution of the air. So definitely there are biotechnological interventions
So
which
at
can
home,
happen.
from curd to
Curd
chaach
to
to
everything.
maybe pickles, they all somewhere the biotechnology
Somewhere the
is.
biotechnology is involved. Microorganisms are there around us every time, and how to use the living organisms for our development and growth and find solutions is actually biotechnology. Earlier, from time immemorial, it has been used, but we did not know the scientific principles because microscope was developed later, and we did not know. Now we have to
You have
know.
lived the American dream. How do you see the Indian dream? How the Indian dream would be for everyone?
Indian dreams would be based on sustainable growth, based on taking our tradition and culture along with the modernism, based on development which does not disrupt or which does not obstruct for our future generations. So this is wholesome growth that I'm seeing, wholesome, wholesome that you can have in your life. That is the Indian dream. That is.
Wonderful. So we had a wonderful conversation with Dr. Jitendra Kumar today, and there has been so many topics. I think I was amazed to hear the variety and the spread of role of biotechnology. I don't think it can be covered in one podcast. Every area which you have touched upon may call for a full podcast to discuss, but we will look forward to maybe continue this conversation and go more deeper in future. Thank you so much,
My
Dr.
pleasure.
Kumar,
My
for joining us today on this episode of How Boring. And we believe that our viewers will find a lot of interesting facts and perspective in this podcast, which will definitely not leave them bored in this episode of How Boring. And also, if you like this podcast and you want to hear more about the role of biotechnology, कैसे हमारी जिंदगी में बायोटेक्नोलॉजी का रोल है, उस हमें हेल्दी रहने में, हैप्पियर रहने में, खुश रहने में, प्रोग्रेसिव रहने में और प्रोडक्टिव रहने में, तो ऐसी बहुत सारी इन्फॉर्मेशंस को अगर हमें और जानना है तो उसके लिए डॉक्टर जितेंद्र कुमार का के साथ और कॉन्वर्सेशन करना होगा, पॉडकास्ट करना होगा. अगर आप लोग 1000 से ज़्यादा लाइक करते हैं इस पॉडकास्ट में, तो आई एम श्योर आई वुड रिक्वेस्ट डॉक्टर जितेंद्र कुमार टू कम बैक टू हैव अ कॉन्वर्सेशन ऑन दैट. थैंक यू.